So now I'd like to call up street medicine.
Good afternoon, everyone. My name is James Kaufman. I'm going to be speaking about the idea of a street medicine program here in the city of Coatesville. So the ask, we're looking for partnerships and also some funding assistance. So we know we have the Equity Health Center that will be happening here in the Brandywine Health Center in several months, which will include partnerships with the hospital, federally qualified health center, also other amazing health, human, and social service organizations. We would also need partnerships with a mental and behavioral health center, a street outreach team, and also the local homeless shelters. And in terms of funding, looking for a grant about $5,500 and also some in-kind donations. So why did I submit this idea? I'm very familiar with Montgomery County's street medicine program. I know of its many successes getting the homeless population connected with healthcare and also some housing and other social services. I've been a lifelong resident of Coatesville, graduated from Coatesville High School back in 2015. I also have a background in public health. I received my master's of public health from Westchester in May of 2022. So how do we increase health promoting activities in the greater Coatesville area? Well, we can start by bringing some health and well-being opportunities to our unhoused community members and also those struggling with housing stability by meeting them where they're at, whether that be on the streets, if they're living in their car, if there is an encampment somewhere, we meet them where they are at. Persons in poverty in Coatesville is about 27%, according to the 2020 census. In the 2022 point in time count, which took place January of last year, there were about 402 individuals who were homeless within Chester County. The map on the left shows the area deprivation index, or the ADI, which takes into account of many social economic measures, such as education, income, etc. Those in the red and the orange have the highest ADI. They correlate with higher chronic health conditions. And it's also important to note that recently the Coatesville community lost a hospital as well as some other critical health services. So the solution, so a street medicine program could bring mental and behavioral health services, general health services, social services to those experiencing homelessness as well as housing instability. So instead of an individual delaying care due to inaccessibility or maybe even cost, the street medicine providers can deliver general health services such as primary care or urgent care right here in the community on a weekly basis. Like I said, that could be on the streets, at the encampment site, or even if an individual is living in their car. So here's a tentative timeline. So it would start here by introducing this idea to the Coatesville community. From May to July, we would form partnerships, apply for some grant funding, and continue to plan the program. From August to December, we would launch a pilot test to assess the program's weaknesses and strengths and address them accordingly. From January to July of 2024, we would implement the program, and then in August of 2024, evaluate how the program has done over the last year and some months. So financials, so that grant funding would cover the medical supplies, which would include but are not limited to bandages, wound kits, suture kits, blood pressure cuffs, over-the-counter medications, as well as some healthy snacks. So when we go see those patients out on the street, we can make sure that they are fed, have some healthy snacks with them. Staff time and meeting space would be in kind. So staff time is completely volunteer. And then the meeting space would be used for debriefs before the team goes out and then after the team goes out. It can also be a meeting point for individuals to come see the street medicine team to seek care. And although no revenue is produced from this program, it can help to reduce unnecessary emergency department visits across other local hospitals, saving them some time, money, and resources. So the team, so a program administrator, it could be me, it could really be anyone that has experience with program administration, grant administration, data analysis. We would need to recruit some additional team members such as physicians and other medical professionals such as a nurse practitioner, a physician's assistant. We would need nurses, mental and behavioral health specialists, community health workers, and then also some street outreach workers as well. And this is my contact information. If you're interested in connecting or if you have any questions, you can email me, text me, connect with me on LinkedIn. I'm happy to connect.
I'll start. So thank you for that. I think this is incredibly needed. I think sometimes we assume that folks who need healthcare are going to come to a facility, and we know that that's not often the case. So going to them makes a lot of sense. How do you envision building trust with folks who are unhoused?
So that would kind of go into the pilot test, especially if they see familiar faces on a weekly basis, like the same faces that are going out. Hopefully that can build some trust between the patients and also their providers who decide to volunteer on the street medicine team.
That's great. And just one suggestion, when you're thinking about snacks for folks, there might be a good partnership with the Chester County Food Bank. They might be able to provide free, so you wouldn't even have to spend money on food, just as a suggestion.
Yeah, that's a really great suggestion. Thank you so much.
Thank you so much for your presentation. Again, I'm not going to reiterate what was just said. I would love to hear a little bit more about the Monco version. Like, do they collect data? Is there data somewhere to see how effective they've been and exactly what their process is? Also, how do they continue their funding? Where do they get their funding from?
Yes, so right now the Montgomery County Street Medicine Program operates mainly in Pottstown, but they also go out to Norristown. I don't have the data off the top of my head, but that's certainly something I could look into. I do know that they have been very successful in getting patients connected to healthcare, whether that be primary care or even specialty healthcare, and also getting them connected with housing, mental and behavioral health services. And they do get their funding from a grant.
Just a few, thank you very much. And as we've seen, our homeless population is growing, so this is going to have an even bigger need. Just a couple of comments on your presentation. I know when you started, you asked for the ask up front, and I think that you should, in my opinion, hit the problem up front and hit your solution up front and why you're different and those things, and then hit them with the ask at the end. First of all, it's going to make it more memorable, and then the slide can stay up while everybody's talking. But also, I think if it makes the funding and the ask more tied in to the how you're going to solve the problem.
Thank you.
Hi, thank you. I agree. First of all, with the ask, more because I wasn't sure what the program was. So you were listing the ask, but I couldn't relate that back to anything. I thought it was great that you're modeling this after another program. I had a similar question about, if you're bringing that up, I think it'd be very helpful in a presentation to say, this is what they're doing, this is how they do it, this is how they've been successful. I thought your timeline was excellent, so thank you for that. And it seemed reasonable, I thought. And the only question I thought that, in another presentation you could hit on is it was a little unclear to me how people actually find out about the service, how they actually access the service. So I think that might be helpful for, especially people who aren't in healthcare, medicine, behavioral health area. So, but thank you. That was really great.
Yeah, thank you so much.
Again, thank you for your presentation. I do like the concept of meeting individuals where they are. Just be more curious to hear about what that looks like, whether or not these are going to be pop-up mobile units where families can come and receive, various treatments. One need I do think we have here in the community, especially at many of our parks, is the need for automatic external defibrillators. AEDs, with the sudden cardiac arrest issues that you see surface from time to time, that would be something you may want to consider as far as implementing as part of your program, donating and posting those AEDs throughout the community, so they're on hand for individuals should something like that occur as far as sudden cardiac arrest. But again, I truly like the concept.
Thank you. I like that suggestion.
Thank you. I also really like the model that you are envisioning, and having the model in Montgomery County being very successful and following the same model here. It's a great need. I think that's great. One suggestion, and perhaps you already have it, is the time frame to recruit the different providers and making sure that actually the community know how to access the different services, but also being able to have the providers right there. So I think that might, if you consider the time frame a little bit longer, because it might take a little bit more efforts. But
Thank you.
thank you.
So thank you for your presentation. I think certainly at a time when we no longer have a hospital near Coatesville, it becomes even more imminent, these types of services. I'm probably the only person on the panel who knows all about the Montgomery County Street Program or Street Medicine Program, which it is phenomenal. And so I think it would be great to be able to replicate that model in Chester County. The one question I did have, and I think it's great that that particular model has been able to recruit those in-kind clinicians to be part of the team. Do you have any thoughts around how you would go about recruiting those in-kind members, physicians, nurses, for a team here?
Yeah, so I have been kind of thinking about that. Hopefully kind of form the partnership with the Alliance for Health Equity, for example, to kind of get those contact names and be able to reach out that way. Maybe they could even post something, but that thought has been in my head over the last couple days as this presentation was nearing. So,
All right, thank you.
yeah, thank you so much.